said, sometimes you can get up to 25 bites on it. And one of the other concerns with the TScan is how do you bill for this? How do you incorporate it in dental hygiene and then start billing for it? Well, there's three things you can do. You can, number one, don't charge anything and just make it part of your world. We don't charge when we use the intraoral camera, so I'm not sure that we should charge when we use the TScan in this application. You could build it into your fee, which many practices do. So if you're, you want to bump your dental hygiene fee up, or your retail exam fee up by $10, you can do that. Or you can run it separately, bill separately. If you're using insurance, you can, in the United States, here's an unspecified diagnostic procedure code that you would use. In Canada, where I am here, we use a specific exam code when you're billing separately. If you're using it for an equilibration appointment, then you can use the equilibration codes that are out there. But I really believe that to get this incorporated in your office, don't charge anything for the first little while. Just make it part of your world, and the return on the investment comes in the treatment that you will generate from using the TScan. One problem that may happen in the practice is that the doctor will say, okay, now let's start using this on all of the hygiene patients, and this is a real-life situation. This happens in the offices, and the hygienists, and you're all probably chuckling because this is probably what happens in your office. You go, oh, I don't have time to do this. I'm so busy already, and how am I going to, I need more time and into my schedule. And then what ends up happening is it gets put on the back burner and it doesn't become part of your practice. And I really encourage the doctors to do the following. And all the hygienists listening are going to be mad at me for saying so, but this is the reality of it. If you want to make it work, you got to do it. You can't just talk about doing it. You got to really make it work and make an effort. So I suggest to the doctors that when the hygienist needs the doctor to come in and do their recall exam, or the checkup, if you will, that if the TScan data is not up on that computer screen, that the doctor just walks out until the TScan data is up on the computer screen. And you'll only do it once or twice before you learn the lesson that you really want the TScan data as part of your new examination. And believe me, when you start looking at this information, you will want it for all of your patients because it's really valuable. When asked if the patient wants high-tech or low-tech, they always say high-tech. They don't want low-tech dentistry, so it sells itself. And we learn by doing. So the only way to become affluent with TScan data is to use it and use it often. It'll become second nature, and you won't imagine your exams without it. And remember that this TScan does not have an opinion, but it surely adds value to your comprehensive treatment and examination. Before I actually open the live software, I just want to show you quickly how easy this is. It's basically a handle. I like to wear a glove on the hand that I'm going to put in the patient's mouth, but when I'm using the TScan handle, I don't wrap mine with a plastic, although you can. You could put a saran on. You can't sterilize this handle, so you really want to be careful. I know that I'm not going to be putting my ungloved hand in the patient's mouth, so I'm using this like I would a keyboard, if you will, because all of the controls are right here. And you activate the TScan data right here with your thumb. So you want to place the TScan in the patient's mouth as you would an upper impression. So I come in, I'm right-handed, so I come in from behind the patient. I'm going to use my left hand to retract the patient's cheek. The important thing here to get accurate data is to be sure that that TScan is parallel to the occlusal plane of the patient. This is an edentulous patient. And you can still see that the handle remains parallel, because if I start tipping it on its side, I'm going to get incorrect information. And I really want the data to be accurate. That is the key to getting good information, is how you are positioned and how your patient is positioned. And then you just activate it with your thumb, and there's a few different traces that you can take, or movies. And all in all, it'll take about 2 minutes. I'm actually going to go ahead and do one on myself, and you'll see how quickly you can gather the data and the type of information you get from it. So this is me, and I'm looking at the computer, but I think that this is this is going to be really effective for you in seeing what kind of information you can get. Now the TScan software, this is the me, I've got myself entered already, very easy to use. You know, we'll do individual training with you, but basically like Windows-based software. And all the movies, the movies, they're called movies because they are in real time, a history of all of them that have been taken. I'm going to do a new one. And you can also activate this all from the TScan handle itself, which I'll do here live. Now these are the Canadian tooth numbers. We can change it to the American, but just so you know, this is the right side and this is the left side. And although it shows that what you would think is the upper arch, it's really the contact of the upper and the lower. Okay, so sometimes you may see a heavy contact in this area, and it doesn't mean it's tooth number 15 on the upper right. It just means that it's in that area. So the TScan kind of gives you a hone in. It allows you to see, narrow in the search, if you will. So I'm going to, you may want to write down these few quick little pointers for those of you that are going to go back to the office tomorrow or Monday and use the TScan, because this is how simple it can be, okay? The first thing you're going to do is you're going to check the sensitivity, because if we have too much markings, like too much blue or too much red, it's not accurate. So we want to be able to be patient specific. So the first thing you do is check the sensitivity without recording. So we want to see 3 or 4 little red spots. So I'm going to go ahead and bite on the TScan sensor. I'm not recording the data, and this is exactly what you would do to the patient. So I just bit 3 times. I didn't record anything, but I was able to look at 2 things, and I'm going to go and do it again. And this time I want you to look for red. We want to be able to see, I'm going to change it to this pixelated view. We want to be able to see 2 or 3, maybe 4 red dots show up. There'll be little squares. And we also want to see that there's this red center of force trajectory. It goes to the same spot each time. That means that the patient is actually biting consistently. So I'll do it again. And watch carefully. Now, if you noted, I really only had 2 little red spots. So I'm going to actually turn the sensitivity up a little bit, just on the fly. And now I'm ready to record. I'm going to have a little bit more red, which doesn't change the data. It just changes the way we see the data. You need to see some red. That might be almost too much. But we're going to go with that. So now I'm going to record the data. And also, did you notice that that trajectory went to the same spot each time? So we know the patient is biting consistently. Some patients you can't take TScan data on because they have myofascial problems and they can't bite down the same way twice, or if they have a sensitive tooth that they won't bite on, they're avoiding it. So you're going to need to be able to use this information to say, you know, you can use the TScan to help determine that the patient has some other things going on. Now I'm going to record it. You probably won't hear my computer beep, but it does give a little beep when the recording is starting. Okay, so it's to just, and I'm just going to bite down.